President Trump says his next major priority is lowering the cost of health care and prescription drugs. In his State of the Union address, the president said that his administration's policies led to a decline in drug prices last year, and he called on Congress to do more. Tony Dokoupil shows us the challenges in bringing costs down and the great distance one family travels for life-changing medicine. Tony, good morning.
Good morning. Americans spend more on prescription drugs than people pay in any other developed nation, an average of some $1,200 a year. And for some, the cost is so high, they're forced to take extraordinary measures. How extraordinary? We talked to one father who, in order to save tens of thousands of dollars on his son's medication, travels to Canada 4 times a year.
So right now I'm paying $15,000 a year for this medicine, which costs the United States $53,000 a year, which I feel is at best criminal.
John Yeagley says his 21-year-old son has a condition where he started losing his hair around the 7th grade. Only one treatment worked, but the drug wasn't covered by Yeagley's health insurance. So every 3 months he drives 6.5 hours to Canada to buy the medicine.
There's no reason why an American should pay 3 times what somebody in Canada or Europe or Mexico has to pay.
That sentiment was echoed last night by President Trump, who promised to slash the cost of prescription drugs.
I am asking Congress to pass legislation that finally takes on the problem of global freeloading and delivers fairness and price transparency for American patients, finally.
Last week, the administration proposed a rule to lower prescription drug prices by encouraging manufacturers to pass discounts directly on to patients, instead of giving those rebates to middlemen known as pharmacy benefit managers, or PBMs. It says this historic action moves toward a new system that puts American patients first, while bringing new transparency to prescription drug markets. But the PBMs oppose the administration's plan, saying it will undercut their ability to bargain with drug makers for lower prices. Express Scripts, acquired last year by Cigna, is one of the nation's largest PBMs.
We get accused of being the middlemen, but the reality is the most sophisticated employers and health plans employ us to drive better care at a lower cost. In the absence of PBMs, patients and plan sponsors would be spending literally billions and billions more on an annual basis.
The proposal from the administration would have to be passed by Congress. But even if it passes, consumer advocates recommend you shop around for prescription drugs, the way you would for any other product.
Prices can vary by a lot. The same medication could be $8 at one pharmacy and $58 down the street. You just don't know until you ask.
For John Yeagley, reform can't come soon enough.
To my son, the medicine is priceless. I mean, it's given him an entirely new identity. I believe it has meant everything to him. It's made a tremendous difference in his personality and in his well-being.
And if you're wondering if there are lower drug prices out there, our consumer advocates suggest checking online resources like GoodRx and Blink Health. But even then, those prices may not be the lowest. She says the cash price may be lower than your insurance price. I feel funny even saying that. It sounds like college again here. You know, it's not a part for your car. It's not any other product. It's medicine for your body.
Yeah. It feels like college. Did you do well in college?
Excellent. I did well.
It's a good look.
Thank you so much. Thank you so much.